Now, health authorities here in Germany are sounding the alarm about the growing number of COVID-19 cases. Today's figures show a huge increase in the 7-day average to more than 150 confirmed infections per 100,000 people. Hospitals have been pleading with the government to tighten restrictions. Doctors also point out that the average age of COVID-19 patients in intensive care units is getting younger.
Es geht einmal nach rechts, ja?
Nicht erschrecken.
Achtung, ich drehe einmal etwas den Kopf.
Doctors and nurses fighting for the life of a 51-year-old father with COVID-19 in this intensive care unit. Germany's third wave of the pandemic has been hospitalizing younger victims since the more contagious British variant took hold. We are seeing a significant drop in age. Most of our corona patients are between 40 and 60 years old. They're much younger than the second wave. And we're also seeing a more aggressive disease. These younger intensive care patients are intubated and have to fight a long time. And it's still a dangerous, sometimes fatal disease. Despite repeated warnings from healthcare workers about the urgency of the situation, German lawmakers are mired in a fierce political debate over restrictions imposed to fight the pandemic. A new law to fight COVID-19 is in the works, and a decision is due Friday. But doctors on the front line are frustrated. It is difficult when you're here every day fighting for patients to see that, on the other hand, the measures to protect against the spread of coronavirus are not enough to control infections. The question remains, how many more Germans have to die before lawmakers do something substantial to stop the surge of COVID-19?
For more on this story, we can speak now to Dr. Nikolai Savaskan. He's the head of the health department of Berlin's district Neukölln. Welcome to DW. Let's take a look at the situation here in Berlin. The number of COVID-19 cases here is growing. So can you tell us how health officials and also intensive care units here are coping?
Well, yeah, the 7 days incidence is growing to above 120 per 100,000 in Berlin. And here, especially in the district of Neukölln, we have actually a 7 days incidence of over 180. The ICU situation in this district here is that we have 21 beds and they are pretty much busy. And noteworthy is actually that the system of ICU beds and booking system is centralized. It's a system called SAFE, in which patients get distributed over all Berlin's hospitals, which have ICU units.
We saw in a report that this disturbing trend that the patients who are in intensive care units are growing ever younger. Is that something that you're seeing as well?
Right, that's the situation. And with the younger age, there's maybe the good news that the prognosis is much, much better than in older patients. But the number of patients, that is what really is a problem in the moment, yeah.
Okay, so with the intensive care beds filling up, the number of infections here in Berlin rising, what would your message to the government be right now? What needs to be done to curb infections?
Well, first of all, the governmental plan of a federal emergency brake has two pitfalls. First, the bellwether or signal system actually is solely based on a 7 days incidence indicator, which is quite poor and also quite unspecific as a signal to detect epidemiological effects. And second, the government plan has a catalog of prohibitions, and from the scientific point of view, there are a lot of prohibitions actually which simply do not make sense. And this makes the whole program actually vulnerable even for justicial arguments. So we need predictability of legal decisions in the communities to be in action. Okay. So altogether, this plan is not really a break.
And Dr. Savaskan, how worried are you personally about what we're witnessing right now in Germany?
Well, I think Germany has a great health system, and we have all the hospitals, all the doctors. What needs now is actually three things. First of all, we need to continue with our vaccination program. And I mean, really, we need to start with our turbo. Second, we need more testings. This is also very crucial in containing the situation or the virus. And third, very important, is we need to communicate. I mean, the authorities, we need to raise an understanding for the containment and for all the measures we take. And maybe the last thing is, if we are talking about the lockdown, then maybe we should really talk about a real lockdown, so to speak, a shutdown like Portugal did.
We'll have to leave it there. Dr. Nikolai Savaskan, head of the health department in Berlin's Neukölln district, thank you very much.